Okay, so these are 2 pregnancy don'ts. There are a lot of pregnancy do's, but there are a lot of pregnancy don'ts, and today we're going to review 2 things that you should not do when you're pregnant. So one is don't sit up straight from laying down. So the problem with this is it can split your abdominal muscles. Your body is under the influence of a very important hormone called relaxin, and this literally relaxes the tissues and the muscles. So ideally, it's supposed to just be released, during childbirth to allow for opening of the pelvis, to allow the baby to drop and be delivered. But in reality, it's being released throughout your body, and so this makes connective tissue a lot more vulnerable. So you don't want to go from laying down to sitting up because there's a connective tissue structure in between your 6-pack abs in the front, and because it's so softened, it can allow for the abdominal muscles to split. So you don't want to induce this by going from laying down to sitting up. In the first trimester, not such a big deal, but as you move on, it's going to be a bigger deal, and soon it'll be impossible for you to go from laying down to sitting up. But I want you to think about instead log rolling to the side, and then pushing yourself up to sit off the edge of the bed. So, remember these body mechanics because you don't want to make it harder to rehab these muscles after childbirth. So try to prevent the splitting of the abdominal muscles, log rolling to the side and sitting up. The second thing that is a pregnancy don't is don't ignore signs or symptoms that feel a little weird. So maybe you're feeling a little foggy and you think it's pregnancy brain, or maybe you're feeling like your legs are a little extra swollen. Maybe you have a headache and it just doesn't feel right. So this could be signs of something called preeclampsia. And if you have a blood pressure machine at home, it's really important that you monitor your blood pressure. And so especially when you're feeling these kind of symptoms. So if you have blood pressure of 140/90, that's a sign that this could be a serious condition for you. Preeclampsia is a hypertensive disorder during pregnancy. It can be managed, but your OB needs to know. So again, if you're having these kind of signs or symptoms that seem a little weird, or you feel a little bit off, don't just pass it off as pregnancy brain or just feeling weird during pregnancy. Go get checked out. It's better to be safe than sorry.